everyone. It's great pleasure and great honor for me to be here today with Professor Davide Carvalho, who's kindly accepted my invitation for one of our EYRC interviews as part of our training program. Professor Davide Carvalho is well known by everyone, but just to recap, he's a consultant endocrinologist, a professor of endocrinology at both Faculdade of Medicine in Porto, as well as in Hospital João, where he did his most part of his career, and has been the head of the department for many years, including was my professor during that time. So Professor Davide has occupied many distinguished national and international positions in several reputable endocrine associations, and now has been recently nominated as President-Elect in ENEA. Professor Davide, as a President-Elect of ENEA, how do you envisage to support and help young neuroendocrinologists, researchers, clinicians with interest in the field of neuroendocrinology?
I believe that the young endocrinologists that are at the European Neuroendocrine Association, members of the EYRC, are the future of society. I think that we need to support the role and the work of these young endocrinologists, because I feel that they bring innovation to society. They bring innovation because they have research, and research give us new opportunities to go depth in the neuroendocrinology, and they are also very important to innovate care and to innovate also research that brings later on an innovate care. I think that for clinicians we can also have, as you know, we have a very good database organized by different studies that were performed under the supervision and the support of society, and that database we could transform that database to be available after the first publications to force research later on, as it was done in different other aspects.
So let's move now a bit more towards scientific and medical related questions. So your center in Porto was the only Portuguese center participating in the multi-center link trial, testing and assessing the efficacy and the safety of osilodrostat. I wonder if you could summarize the main highlights regarding the efficacy, the safety and the profile of this drug, and if you consider this as a game changer in the treatment of Cushing's syndrome.
Obviously, osilodrostat is really a new drug that you have available for the medical treatment of the Cushing syndrome in general, and importantly in the case of the Cushing disease. Osilodrostat is a new steroidogenesis inhibitor. It acts inhibiting aldosterone synthase, but also 11-beta-hydroxylase, and induced marked reduction in cortisols. The efficacy is around 75-80% of the patients are controlled with this drug. And what is more important, and as you said, is considered a game changer, because previously we used ketoconazole, we used tirapon, but they need several administration. They have problems with liver toxicity, and this osilodrostat is very efficacious. It's just twice a day administration, what improves the compliance of the patients. Obviously could induce in 50% of the patients hypocortisolism, that is demonstrate the efficacy of the drug, so we need to be careful. And the classical effects of nausea, vomiting could be present, because it indicates some degree of hypocortisolism, but really it is a well-tolerated drug in general if you follow carefully the recommendations and obviously you need to control the levels of cortisol to decide which drug or how to up-titrate the dose until you have the control of the disease.
So, Professor David, still on Cushing's, what are the main clinical and management challenges in Cushing's, and how actually do you see clinical and basic research to help us in improving those and provide better care for our patients?
Cushing disease is really a challenging disease, and as Niccolo Machiavelli said, initially the disorders are difficult to diagnose but easy to treat. Later on they are easily diagnosed but have more difficulty to be controlled. And that means that we need to have a high degree of suspicion, to have very slight signs and symptoms, and try to confirm if there is any disorder that is behind that effect. And really another aspect that is important, as you can see, we have in general 3 different ways to screen for Cushing disease. You can use the urinary free cortisol, you can use the overnight dexamethasone suppression test, you can use the cortisol salivar. When we compare, for instance, with acromegaly, just we measure IGF-1, we do just one measure, we have the results of suspicion. With these 2, that means that they are not good enough to screen, so we need several. Afterwards, maybe in some times, if these cases are, these tests are not confirmatory, you need to go for confirmatory tests. So we have different steps. The same is also for the treatment, because it's challenging the treatment, because sometimes the imagologic evaluation do not demonstrate clearly a tumor, and you need to go to other diagnostic tests, namely inferior petrosal signal sampling, and with some difficulties also to evaluate this. And later on we go to the surgery that remains as the best way to initially treat the Cushing disease. But at that moment, if the tumor is very small, we are not sure if we can find it or we can completely remove it. And what happens to have different other pituitary adenomas, if there is any kind of invasion of cavernous sinus, is also a difficulty. Obviously that we have significant improvement with the new MRI and dedicated, what I think is most important is to have a dedicated multidisciplinary team with endocrinologists, with imagologists and also neurosurgeons, to have a complete team, including also ophthalmologists and obviously radiotherapists if indicated. And really to have a multidisciplinary team is very important to take care of the diagnosis and treatment of these patients.
Now moving more towards the career-related questions, could you give us some advice and some insights about for young endocrinologists and researchers, scientists, in terms of how best coordinate and manage to become a world leader endocrinologist and researcher, how to actually combine clinical and researcher work, and perhaps more importantly, how to well balance our work and private life?
That's a very important point. My first advice is please, either to the basic researchers or clinical researchers, I think you need to focus in a topic because sometimes our attention is called for one aspect to the other, and I feel at least in clinical research sometimes we are changing the focus or the topic. I think the most important is to be focused on your topic, and if you go depth in the topic, you will be had opportunities to develop, to publish, and to reach a big higher level of quality. Obviously, that you need to combine your work and your family. Is important to have that, and usually the family is a support too, because we have challenges and sometimes things are not going as we wish, and we need to have support. So it's important that it's important that you give back to the family also some support. So this equilibrium is very important for the future, and I think you need to preserve also that aspect.